Hello, I am Dr. Aditi Chauhan and I am from Health in India. Today we will be interviewing Dr. Sunil Marva. He is one of the leading orthopedic surgeons these days and he has experience of more than 30 years. So let's talk to Sunil Marva. Sir, can you please tell us about yourself?
I did my graduation from BHU, Banaras University, way back in 1974. Probably you were not born that time.
Yeah.
I did my post-graduation from there in 79 and I left the country for higher education.
Okay.
Part of the time I was in UK, then I did some special courses from Harvard, and then I was working for 15 years at King Faisal University, Saudi Arabia. In between I also worked for 2 years at Lusaka Central Teaching Hospital in Zambia. I came back to the country in 95 and since then I am here. Earlier I worked with Privat Hospital full-time, and then I became independent consultant and have been working earlier with Paras and Apollo clinics, but now I am selectively working with Artemis Hospital.
Sir, please tell us about the common orthopedic disorders you find these days on people.
The commonest orthopedic problems that I've picked up after coming back in last 10-15 years is what is called as RSS, repetitive stress syndrome for the cervical spine and lower spine, leading to frequent disc ruptures and spine problems. So that's one of the commonest side. Second thing is a lot of lifestyle diseases related to the knee joints, osteoarthritis of the spine, because a lot of people or most of us are leading chair to car lifestyle, and then on either we put the knees and all to a weekend stress of huge amount of stress, like we want to eat 1 week's day in 1 day's time. So that's the problem. So the knees tend to wear out faster in Indians than in others, and that's the issue out there. The treatment option for the spine, RSS, number one, not to consume painkillers as we do normally in this country. That you go to a chemist, you pick up Comiplan, Mobizox and eat it. A pain is telling you, help me. So it's very important, why is the body asking for help? Yeah. So you treat the cause and not the pain. The pain is God's given gift. It tells you, help me. It tells you, don't do this to me, I'm getting more trouble. When you take a painkiller, you are just putting a lid on the problem and you are taking away protection. But that's what we do because we want to get a quick relief. So the idea is not to take painkillers. Yes, you need to sometimes change your lifestyles, how you sit and work. If you have got severe vitamin D, B12 deficiencies, cover them up. You sometimes need to strengthen your back muscles, neck muscles to reduce the RSS syndrome. So, which is, if you take care, you don't land up in a full-blown disc trouble. But asking or taking painkillers for a quick relief, that's what gets you into trouble. As far as knees are concerned, somehow the notion is that if the knee gets buggered, you just keep on letting it worsen, keep on taking painkillers, and ultimately you end up in knee replacements. That is the most wrong way to go about it. No, there are a lot of things which have developed in the last 20-25 years in which we can stop your knee from deteriorating so that you do not land up in knee replacements later on at an earlier age. So viscosupplementation is the issue which we do to give you a cover up in your knee cartilage. So there are a lot of newer things, but you need to touch base with the right specialist for your problem and not to deal with the chemist related painkillers for any of these things. That's the trouble out there. Yeah, and a lot of these lifestyle diseases are self-created, and with simple measures, once you get the correct advice, you can have it sorted out.
Okay.
Yeah.
And so, what are the recent advances in the treatment area?
The recent advances in the treatment area is that, especially for the spine, now we have got drugs which can actually repair the disc so that you don't land up in surgery. Similarly, for the knees, there are huge amount of newer medication which are put directly into the knee painlessly in 5 seconds to give a cover to the wearing out cartilage, so that you actually take care of the problem. You don't treat the end point, the pain, you treat the cause. And when you go on that line, then you are able to take care on these issues.
Okay, and so what one advice you want to give to the young population, because you see lifestyle diseases are on rise.
Yeah.
So one advice you want to give to
One
the young population?
advice I give to the lifestyle, for the lifestyle disease is do not lead a chair to car lifestyle. You think that you have got an insurance policy for health, something happens and you're going to use that health policy, and that health policy is going to take care of it. That is absolutely going up the wrong side, because health policy, the only person who makes money is the hospital. Your body takes a toll. So you have to have a system in place that you don't need to use the health policy. So for that, the only way that can help is the lifestyle, which is don't lease chair to car lifestyle. You should have a reasonable working environment, certain off time to do physical activity. If you have any issues like more weight, blood sugars, uric acids, any of the chronic issues, have them under control at the right time so you don't accumulate the damage in your system.